Hi there. Let's talk about a topic that is extremely relevant and often misunderstood: social anxiety. First, it's crucial to understand that social anxiety is not just shyness. Although both can make someone feel uncomfortable in social situations, they are quite different concepts. Shyness is generally seen as a personality trait. Shy people might feel nervous or uncomfortable in social settings, but it doesn't significantly interfere with their lives. Over time and with exposure, shyness can diminish, and these individuals usually manage their feelings without much complication. On the other hand, social anxiety is a diagnosable mental health condition. Those who suffer from it experience an intense and persistent fear of being judged or humiliated in social situations. This fear is so strong that it can prevent a person from carrying out everyday activities, like speaking in public, eating in front of others, or even attending social gatherings. A clear example of this can be seen when someone thinks about going to a party and starts to feel an overwhelming fear of being watched or not knowing what to say. This fear can result in real physical symptoms, such as cold sweats, trembling, and even a panic attack. Therefore, it's important to recognize that while shyness is an aspect of who we are, social anxiety is a condition that needs understanding, treatment, and support. And remember, this content is meant to inform and raise awareness. I always recommend seeking help from a qualified professional if you think you might be dealing with this condition. Now let's detail the signs that may indicate the presence of social anxiety in a person. Understanding these signs is crucial for recognizing the condition and seeking appropriate interventions. Let's discuss an extremely relevant but often misunderstood topic: social anxiety. Specifically, I'll tell you about a very common sign of this type of anxiety, which is extreme self-consciousness. Have you ever felt like all eyes were on you, even in a casual situation, like walking down a street or being at a party? This is a classic example of extreme self-consciousness. People who experience this often have an intense fear of being judged by others. They are constantly worried about how they present themselves, their actions, and even their facial expressions. I'll tell you about John, someone I met at a conference. Joao avoided starting conversations and always stayed close to the exits. He confessed to me that he felt extremely anxious in social environments because he was convinced that any small mistake would immediately be noticed and judged by everyone around. This level of self-consciousness is not only exhausting but can also lead to avoidance behaviors. For instance, people like Joao may decide not to participate in important social events, which ultimately limits their opportunities to make new friends or advance professionally. The good news is that there are strategies to manage this anxiety. Therapies focused on relaxation techniques or cognitive behavioral therapy can help a person feel less self-centered and more comfortable in social environments. This is just a start, but it already makes a big difference. Now let's talk about another very disturbing aspect of social anxiety: uncontrollable nervousness. This type of anxiety manifests physically and can be quite debilitating. Imagine you have to take public transport, something many people do daily without problems. For someone with severe social anxiety, this simple task can become a huge source of stress. There might be an irrational fear, for example, that everyone is watching and judging every move you make, from the moment you enter the bus until you choose a seat. Once I talked to Anna, who described her experience on a crowded bus as a real torment. She felt her heart racing, her hands were cold and sweaty, and she could barely make eye contact with other passengers. The mere touch of someone passing by could trigger a wave of panic. This type of nervousness is not something you can simply switch off. However, there are ways to learn to manage it. A useful technique is mindfulness, which helps a person focus on the present moment and reduce the worry about others' perceptions. Practicing regularly can help reduce the intensity of anxiety in situations like these. Another approach is gradual exposure to the feared situations under the guidance of a therapist. Over time, this technique can significantly lessen the fear and discomfort, allowing the person to face social situations with more confidence. Another striking sign of social anxiety is interference in performance in social and academic situations. For those suffering from this aspect of anxiety, actively participating in group activities or contributing in environments like the classroom or work meetings can become a huge challenge. Let's consider the academic environment, for example. A student with social anxiety may know the answer to a question asked in class, but the fear of speaking in public and being evaluated or wrongly judged by peers or the teacher may prevent them from raising their hand. This can be frustrating, as it prevents the student from demonstrating their true potential and even fully engaging with the study material. A case that illustrates this is Camila, a very intelligent university student, but who rarely participated in classroom discussions. She told me that whenever she thought about speaking, a wave of anxiety would overwhelm her, causing her mind to go blank. This made her feel isolated and misunderstood by classmates and teachers, who might interpret her silence as a lack of interest or preparation. Anxiety can also affect professional performance. In work meetings, for example, difficulty speaking can prevent a professional from sharing valuable ideas, limiting their opportunities for contribution and career growth. To deal with this, strategies such as social skills training, which includes public speaking exercises and group interaction, can be very effective. Additionally, therapeutic support to build confidence and learn anxiety reduction techniques before and during interactions can transform these experiences from dreaded to manageable. Now let's consider how social anxiety can directly impact interpersonal relationships. People with social anxiety often face significant difficulties in forming and maintaining relationships, whether friendships or romantic ones. This occurs because the constant discomfort and tension in social interactions can lead to avoiding moments of closeness, which is essential for building strong bonds. Imagine you're at a social event and meet someone who seems interesting and friendly. For most people, this would be an opportunity to make a new friend or even meet a potential partner. However, for someone with social anxiety, the fear of saying something wrong or being judged can be so overwhelming that they choose to stay away and not initiate a conversation. Thus, they miss the chance to establish a connection that could be enriching. An example of this is the story of Marina, who avoided parties and meetings with friends because she felt she couldn't handle the pressure of interacting. She told me that despite wanting to have close friends, the fear of being judged or having to maintain conversations made her prefer to stay home. This constant evasion eventually isolated her socially, which only intensified her feelings of loneliness and anxiety. To overcome these challenges, it is crucial that people with social anxiety receive the necessary support to feel secure in social interactions. Therapies that focus on building self-esteem and demystifying irrational fears can help. Additionally, support groups where experiences and strategies can be shared with others facing similar challenges can be incredibly valuable. Continuing to face these social situations, even if gradually, is crucial for developing stronger interpersonal skills and for reducing anxiety over time. Let's now talk about a rather curious and challenging phenomenon for those suffering from social anxiety: the persistence of anxiety, even with increased familiarity with people or environments. Normally, we would expect that by spending more time with a group or frequenting a specific place, a person would gradually feel more comfortable. However, for those with social anxiety, this often does not happen. Consider, for example, someone who has worked in the same office for years and still feels a strong discomfort when interacting with colleagues, even though they have known them for a long time. This persistence of anxiety can be extremely frustrating, as it contradicts the common logic that familiarity should bring comfort. A case that illustrates this well is that of Carlos. Carlos has been working in an office environment for over 5 years, but still feels great anxiety whenever he needs to participate in meetings or even when casually approached by a colleague. He explained to me that despite recognizing the irrationality of his fear, the anxiety does not diminish over time, which makes him feel even more isolated and misunderstood. This type of persistent anxiety can be particularly difficult to treat because it challenges the notion that continued exposure is a solution. However, therapeutic approaches such as acceptance and commitment therapy, ACT, can be very effective. This therapy focuses on helping a person accept their emotions and sensations without trying to control or avoid them, promoting a fuller life aligned with their personal values, despite the anxiety. Additionally, conscious exposure techniques, where a person is encouraged to face their anxieties in a controlled and gradual manner, can help reduce the intensity of anxiety over time. This is done through habituation, the process by which the anxiety response decreases as exposure continues. Another challenging aspect of social anxiety is the excessive analysis of social interactions, especially details such as facial expressions, gestures, and the tone of voice of others. This tendency can be exhausting and often creates an internal narrative that does not correspond to reality, exacerbating fear and insecurity in social situations. Imagine that you are in a conversation, and instead of focusing on what is being said, you become obsessed with how your voice sounds, whether your hands are trembling or if the other person seems bored or uninterested. This hyper-focus on details can lead to misinterpretations and a spiral of self-consciousness that only serves to feed the anxiety. For example, I met Livia, who after any social interaction, spent hours reliving the conversation in her mind, analyzing every word and every reaction of the other person. She frequently arrived at negative conclusions that affected her self-esteem and her willingness to engage in new interactions. To combat this excessive analysis, cognitive techniques are extremely useful. Therapies such as cognitive behavioral therapy, CBT, help identify and challenge negative automatic thoughts, replacing them with others that are more realistic and less critical. This can help a person have a more balanced view of their social interactions, reducing anxiety and improving their ability to relate in a healthier and less anxious way. Another technique that can be beneficial is the practice of mindfulness, which teaches being present in the moment, observing thoughts and sensations without judgment. This can help a person detach from excessive worries about how they are perceived by others. Finally, let's address the last sign of social anxiety that we listed, the avoidance of social situations. This tendency to completely avoid social interactions is perhaps one of the most visible and debilitating manifestations of social anxiety. People who suffer from this symptom often refuse invitations to social events, avoid situations where they will have to speak in public, or even stay away from any environment that may provoke anxiety. Avoidance may seem like a solution in the short term, as it reduces immediate anxiety. However, in the long run, this strategy reinforces fear and further limits the person's ability to cope with social situations, creating a difficult cycle to break. A clear example of this is the case of Thiago. Thiago has always been a reserved person, but his social anxiety intensified to the point where he began to refuse all invitations to social events, even small gatherings with close friends. He told me that the mere thought of having to interact with others made him so anxious that he preferred to stay home. This not only worsened his loneliness, but also negatively impacted his mental and emotional health. To face this avoidance, an effective approach is exposure therapy. This method involves gradual and controlled exposure to feared situations so that the person can build tolerance and reduce their anxiety over time. Starting with less intimidating situations and gradually advancing to greater challenges can help the person gain confidence in their social skills. Additionally, the support of a therapist or a support group can be crucial. Knowing that there is a safe space to discuss fears and progress can motivate the person to continue exposing themselves to social situations, even if this is challenging initially. It is essential to reflect on the importance of understanding and addressing this condition with empathy and support. Social anxiety is not just a matter of letting go or overcoming shyness. It is a mental health condition that requires appropriate understanding and, often, professional intervention. If you recognize yourself in any of the signs we discussed, do not hesitate to seek professional help. Psychologists and therapists are trained to help people effectively face their anxieties. Therapies such as cognitive behavioral therapy have proven very effective in treating social anxiety, offering strategies and tools for people to manage their symptoms and improve their quality of life. For those who do not suffer from social anxiety, it is crucial to cultivate empathy. Understanding that this condition goes beyond a simple difficulty in socializing can change the way we support friends, family, or colleagues who face this daily battle. Small gestures of understanding and acceptance can make a big difference in the life of someone struggling with social anxiety. Promoting awareness of social anxiety is essential to demystify stereotypes and prejudices associated with this and other mental health conditions. The more we talk about it, the more people will be able to recognize the signs in themselves or others and seek the necessary help without fear of judgment. In summary, social anxiety is a complex and challenging journey, but with the right support and tools, it is possible to navigate this condition more smoothly and effectively. Remember that seeking help is a sign of strength, not weakness, and that you are not alone in this journey.